So,
No. Okay, so what did they do? Just that blank screen is trying to connect?
Yeah,
right
well, 2 events was created, like I told her earlier, but she said she only seen 1. So I started the first one, and she hadn't seen nothing, but she couldn't contact me because there's no service in here.
There's no service in here. Why not?
I got T-Mobile, probably.
Oh. Should we use a different phone?
She called back.
Yeah, she called her.
What happened to the iPad?
Alright, it says published. Can you see it now?
Hi. Hi, this is Dr. Margie Corney, and we're here today to have a little informational seminar on various health issues, and I'm going to allow my worthy assistant, Miss Belinda Pitts, to do a little intro, so that way we'll have a better idea about why we're here today.
Good evening. My name is Belinda Pitts, and we're here at Women First, the office of Dr. Margie Corney. And this webinar is going to be the first of a series where Dr. Corney, who is a board-certified obstetrician and gynecologist, she will come to you offering education and inspiration on living a healthy lifestyle. Here at Women First, we have several services that we offer, not just your regular old gynecologist office, but we offer a weight loss program, we offer sculpture, we offer smart lipo, and we also offer a vaginal rejuvenation laser therapy. And so tonight, Dr. Corney is going to talk to you all about the vaginal laser therapy called FemTouch. It is manufactured through LOOSENESS. Dr. Corney, talk to our audience about this fast, efficient, and simple procedure that can be performed and who can benefit from it.
Well, let me tell you, I'm very excited about this particular procedure and this technique called FemTouch. For so many years, I've wanted to have something to offer to patients that may be suffering from vaginal dryness, vaginal discomfort, inability to have intercourse because of vaginal dryness, and actually vaginal pain. And for so many years, we didn't have anything. It was either estrogen therapy or no intercourse. And that's not necessarily too many options. But the FemTouch procedure is a laser therapy. It's actually a fractional CO2 laser that's designed to cause a revitalization of the vaginal tube. The vaginal tube is the vagina, basically, and this is what we use in order to have intercourse. And I'm sure that a lot of ladies do know that there is more pleasurable intercourse when the vagina is very well lubricated. No friction, no friction. We don't want any pain. We want to be able to spontaneously think about having intercourse and do so. Now, when somebody becomes menopausal or leading to menopause, there is a diminution in the amount of supportive estrogen into the vagina, and what that leads to is poor health of the vagina. The vagina is less flexible, it is drier, and the vagina is actually going to get shorter as we get older, and it'll be less flexibility. Without the estrogen support inside the vagina, which happens to every woman that goes through the change of life and has less estrogen, what will happen is the vagina doesn't get supported with estrogen like it had before, and then what happens is that the vagina starts to become less flexible, more rigid, not enough lubrication, and pain with penetration, pain with having actual intercourse becomes more and more of a chore, less pleasurable. So when you complement that with possibly less drive, we got a problem. So this is a technique, the procedure with the FemTouch is designed to try to make life more pleasant, more enjoyable. And in order to do that, the FemTouch is a laser that actually goes inside the vagina. This is what the probe looks like, and we're going to show you that in a little bit more detail. But this probe goes inside the vagina, and the laser light is actually brought through this opening. And we have a short little video here that we'd like to show you that actually demonstrates how this probe goes into the vagina and does its job, which is mainly designed to create an environment of penetration with the laser light through the entire circumference of the vagina at different levels. Now, in the video, you may see that, the video hasn't started yet, but we're going to get to that in just a second. What happens is the laser light is brought into the vagina, and through a series of rotations, the laser light is treated through the entire vaginal tube at different levels and then brought out of the vagina. And do we have that video? Okay. As we work on the video to try to demonstrate what it actually looks like, I'll let you know that the laser treatment is not just for postmenopausal ladies or ladies that are menopausal. It's for women that are in their 30s or in their 40s that may not necessarily be menopausal, but ladies that are having difficulty with vaginal dryness as well as vaginal laxity. So if you just had a baby and things are not the way they used to be and the vagina isn't as taut as we would like for it to be and the intercourse is not as pleasurable, this would be something that you would think about doing in order to change that particular situation. So the laser is actually used to create this kind of change, and it promotes collagen stimulation. And what you have when you have collagen stimulation is a newer layer. The epithelial layer of the vagina is replaced by new growth and new vasculature. And when you have new vessels, blood vessels coming into the area with new growth, you actually have a benefit of new tissue, and so the vagina is healthier. As we we're just going to give you that demonstration, but let me just tell you, there's typically 2 to 4 treatments that are needed in order to accomplish the benefit of the FemTouch. And when you have those 2 to 4 treatments, typically 3, what's going to happen is that you'll come into the office, we'll prepare you by having you go to the exam room, basically sit on the table. This probe is actually placed in the vagina, and although it looks like it might be ominous and looks like it might be a problem, it really is not uncomfortable. Similar to what you might have if you've had a vaginal ultrasound in the past, the probe is actually placed in the vagina. It's lubricated with a baby oil, so it's really not uncomfortable. So no matter how long it's been since you've had a period, this is something that can be readily placed inside the vagina. Now, a lot of women would look at this probe and say, oh my gosh, no way, I haven't had intercourse in years and I don't really know how we can possibly retard a condition that's been going on for so long. Well, the answer is it works. I've had some ladies that have been in their 70s who have actually had this procedure comfortably. You start out by having the probe placed inside the vagina. The process takes possibly about 5 to 10 minutes. Most women say that they feel something that feels like a vibration. There's no pain involved. We take the probe out and you're off and about on your way. There's no downtime. There is a time frame where directly after, if you have any kind of laser treatment to the outside of the vagina, which can be done at the same time to help with vaginal or vulva, the outside of the vagina, to help with moisture there. If there is any downtime, the downtime is downtime from actually having intercourse. So we're talking about mainly anywhere from 3 days to possibly the most at a week, with you not necessarily being able to have intercourse. There is lubricating creams that we would recommend that you use directly after having the procedure, and the procedure is normally performed monthly intervals. The third treatment would probably be about 6 weeks from the second one. So therefore, 3 treatments typically, and usually the booster, one other treatment is done about a year later for maintenance. So that is the treatment course for the FemTouch. And some of the important pointers to come to would be that the laser is uncomfortable. It is not uncomfortable. It is something that takes only minutes. There is no downtime. And the end result would be that you are going to be having a more pleasurable life. More comfortable. You don't have to think about having intercourse. You don't have to run to try to get that lubricant in order to make sure that you're ready to have intercourse, not anticipating that it's going to be uncomfortable. So that FemTouch is definitely a miracle worker. One other thing that I might mention about the FemTouch is that It is something that can be used to help support the vagina and the urethra. The urethra is where we urinate from. Sometimes when ladies become menopausal or getting close to menopause, they actually have a diminution in the estrogen that supports that area. So what happens is you may even have times when you're going to the bathroom often. You might have discomfort when you're going to the bathroom and to urinate, and you think that, oh, okay, well, maybe this is a urinary tract infection. And actually, it's not a urinary tract infection. It's just discomfort because of lack of good support in the tissue around the urethra that's creating a symptom or in a sensation that there's discomfort because of lack of estrogen support. Sometimes women actually have incontinence as a result because that support of the urethra is gone. So urinary incontinence to a degree, vaginal lubrication, and a more pleasurable and more supportive lifestyle can be accomplished by doing something like the FemTouch. So it's something that we should definitely consider. Now I'm going on about the FemTouch, and I'm wondering whether or not there's anything else that I can ask or answer as a result of this webinar.
Okay. Well, Dr. Corney, you mentioned that there's no downtime.
Yes.
The patient does not have to be put to sleep, so this isn't like your normal surgery where you're put to sleep for it. They can just come right in.
Actually, no, and it's something that you just asked that I might not have mentioned. There is no need for anesthetic. It is not painful. Vibrations are what a person feels when they're actually having this procedure done. So no, there is no general anesthetic that needs to be used for this particular procedure.
So there's nothing that specifically needs to be done prior to the surgery. What about after the surgery? What do I need to do?
Prior to the surgery, there really isn't anything that you need to do in order to prepare. There is some things that you need to do after, and mainly they are refraining from intercourse for at least a couple of days to possibly a week. Outside of that, you can swim, you can jog, you can mountain climb, whatever it is that you normally do, you should be able to go forward with having that done. So it's a good thing.
Okay. How long after we've had the procedure done, how long approximately does it take for the wetness to return?
You say wetness, what exactly are we speaking about?
The moisture or, once you...
I think I got what you're asking me. We're talking about when should I expect to see an improvement in the symptoms that I decided to have the FemTouch for.
Exactly.
Yeah. So typically the treatment course is 3 treatments, anywhere from 2 to 4. So we would probably see a difference at the end of that 3rd treatment. But that being said, most people appreciate a difference after the 1st treatment. And so it's just progressive thereafter. Sometimes women would need to have a booster somewhere a year afterwards. So you have to kind of individualize again to the individual, but it's probably about 3 treatments. That's what we need in order to get the moisture. Now, ladies will tell me all the time, after the 2nd treatment, they've noticed that they're using less lubrication. They don't have to apply any kind of lubricants. Sometimes I might complement the treatment with a smidgen of estrogen, but that's something that is not necessarily performed with every single patient. Okay.
Is this something that's appropriate for women who have had hysterectomy?
It's appropriate for anyone that's suffering from vaginal atrophy and vaginal dryness, yes. So whether your uterus and your cervix is present or whether your uterus and your cervix is gone, it really does not matter. It's not a differentiator. It's not something that's necessary in order for us to go forward with the treatment.
Okay. And for someone who has given birth, how soon can a new mother get this procedure done?
Well, we would think in the postpartum period, somewhere after the 6 weeks, because it takes 6 weeks for things, 6 to 8 weeks directly after having a baby for things to get close to where we feel that you should be back to your usual self. So 8 weeks after that 1st menstrual cycle If someone's breastfeeding, the first menstrual cycle might take months to come after they've given birth. So we'll have to say somewhere in the range of about 8 weeks and beyond after someone has given birth, after they've been cleared, especially if they've had a cesarean section.
Okay, so you mentioned that it may take 2 to 4 treatments. How far apart are the treatments?
The first treatment is, say, August 1st. The next treatment would be September 1st. The next treatment would be about 6 weeks from that.
Okay.
So each time we build on what we've accomplished previously. Now, I think that we're having difficulty getting our film. I don't know whether or not we'll be able to show that to you. But what I'd like to show you, if I can, and I wasn't necessarily planning on taking the probe off the stylet, because sometimes it's kind of difficult to put it back. But what I wanted to show you, if I can, I don't know whether or not we can do a close-up of the device, but this is the actual probe, and I will go on and unleash it if I can do that. I'm thinking maybe that's not a good idea. So, if you can see, this is the probe that goes inside the vagina. So, most vaginas' depth is somewhere between 6 and maybe 8 inches. So we can actually place this inside the vagina. It goes inside the vagina very smoothly, very easily, and when the laser is turned on, the light actually comes through here, and so if the vaginal tube is like this, it goes inside and you go all the way to the back of the vagina. The laser light is going to be penetrating through here into the vaginal wall. So if you have the light directed at this segment of the wall, then you go down, and it's that segment of the vaginal wall, and then it would be this segment of the vaginal wall, and then that segment of the vaginal wall. So it goes all the way into the back part of the vagina. That process takes place. So it's a 360-degree turn. And then we come out of the vagina, one layer. And then we do that same process, 1, 2, 3, 4, 5 times. And then we come back, and then we do the same process until we get to the exterior portion of the vagina. So that's essentially how it works. Now, there are videos available for us to take a peek and see exactly that the laser light actually penetrates through the wall. And what it does is promote collagen synthesis. The collagen creates new growth, new blood vessels. The new blood vessels, anytime you have blood vessels coming into an area, you're going to have healthier tissue, tissue that is kind of close to what it was before the estrogen support was absent. So I'm wondering whether or not we have any questions from the audience that I might answer, because I don't think that we're going to get that video, but we'll be coming to you again, and I'm hoping to come and give you a live webinar of a patient actually having the FemTouch procedure. So that's something that we anticipate part of our series about the different procedures that we do here in the office. That's something that I'd like to bring to you. My patient actually having the FemTouch procedure, so you can see directly how she's reacting. But there are other procedures that we do here in the office. You may see in the background that there is the laser to perform the smart lipo, cellulase, which is actually removal of cellulite. We also do pelave, which is a way to do actually like a facial lift without actually doing any kind of penetration of the face. Radio waves are used in order to create and promote collagen synthesis. So anytime you have collagen synthesis that's being created and promoted, you're also going to have a new type of tissue come to the area. And new tissue is going to be smoother and tighter.
Okay. Dr. Corney, we have a question. Someone wants to know, can I stop taking menopause hormones if I get this procedure?
Well, that's a very good question, and the answer to that question would have to depend on why are you taking hormones. Are you taking hormones because you have symptoms of hot flashes, or are you taking hormones because you're having some difficulty in the vagina? So hormone replacement therapy has multiple indications. One of it would be to try to suppress hot flashes, and the other one would be to try to create a healthy vagina and support the vagina. So if you're using hormone therapy solely for the purpose of trying to promote a healthy environment inside the vagina, the answer is yes. You will not need to take hormones ever again if you have this procedure, because this procedure is designed to restore the vaginal health. Actually, it's a vaginal revitalization, and that's something that I always tell my patients that estrogen therapy intravaginally would definitely be helpful, and it is the thing to do, but it takes a long time, and it requires that you either take a tablet that you're actually placing inside the vagina, use a ring inside the vagina. The applications of estrogen inside the vagina might go on for, you might have to do that twice a week forever in order to restore and maintain good vaginal health. And we live busy lives. We may not necessarily want to do that. And then there's always that concern about what impact that estrogen might be having in other parts of the body. So the answer to that question is yes, if the reason for you using the hormones are to try to restore vaginal health, then this is something that could replace the use of those hormones.
Okay. Let's see if we have any other questions, Dr. Corney. You mentioned vaginal health quite a bit. Yeah. Can you explain to us what is a healthy vagina?
That's a good question. A healthy vagina is a vagina that has a well-balanced pH. One of the other things that a healthy vagina has is the ability to function without creating discomfort. So moisturized, one that is flexible, one that is not painful for you to have normal relations. So the environment is very important. There's a difference between a vagina of someone of reproductive age and the vagina of someone who is not of reproductive age, someone who's postmenopausal. In order to get from mature epithelial cells that are part of the moisture inside the vagina, that help create the moisture inside the vagina, you have to have estrogen. If you don't have estrogen, you're not going to be able to have the kind of normal pH, because it actually promotes a certain type of bacteria inside the vagina. So there are certain types of bacterial infections that we see more so in menopausal women than we see in women that are not menopausal. And so to try to create a healthy environment inside the vagina, we're not just talking about vaginal revitalization in terms of being able to have intercourse. We're talking about having a vagina that doesn't feel dry, that doesn't hurt, one that you don't have to walk around thinking that you have to scratch all the time, or that you have to run to the gynecologist because you have recurrent bacterial vaginosis. So healthy vagina means a lot of things to different people.
Okay, so pretty much this CO2 laser procedure is one that could make me feel better, feel younger. It could just pretty much bring me back to life.
The CO2 laser, FemTouch fractional laser, is one that's designed to try to help the quality of your life. Now, it's not going to make you younger. It might make you feel younger.
It'll make me laugh.
Yes. It'll make your vagina feel better. It's one that you don't have to. I think the main problem with a lot of ladies, and I hear it all the time, is I don't want to think about having intercourse. I want to make my husband happy, but I just don't get anything out of it.
Okay.
And so I'll say to you, it's not worth it's not a lot of bang for your buck, huh? So you're not really interested. Yes, it's almost torture. Now there are a lot of scenarios. There are some women that are not going to have, they go through it and they don't have any troubles at all. But as I was explaining to a patient earlier today, there are some women that actually bleed as a result of having intercourse. You can touch the vagina You don't have to have intercourse and they can bleed. That's how friable things can be when the vaginal walls are very thin as a consequence of not having good estrogen support. And the way to retard that is with the laser.
Okay.
Yeah.
So pretty much with the FemTouch, as it says, I can laugh without feeling the embarrassment of urinary incontinence. I can love without discomfort, and I can live because it gives me a better lifestyle, a better, healthier lifestyle.
I think you could say that's true for all of those things, and I'll put one proviso there. And I want to make sure that I'm clear. The FemTouch is not going to treat all kinds of urinary incontinence. So I don't want people to think that you're going to have this and you're not going to have incontinence ever again. That's not necessarily true, but certain types of urinary incontinence can be miraculously cured as a result of having the FemTouch. And I have one patient in mind that recently had the FemTouch, and she said before she had an improvement in the vaginal lubrication, she had an interruption in her urinary incontinence. It was much better, and she was praising the FemTouch. And so I just want to make sure that we're kind of clear that this is supposed to improve the quality of your life. No one wants to think about what they have to do in order to prepare for intercourse, unless, of course, you're trying to prevent pregnancy. Then you might have to think about it. But for menopausal ladies and ladies that are close to menopause, we just want to be able to enjoy ourselves and enjoy the fact that we have no fear of getting pregnant any longer.
Wonderful. Okay, well, Dr. Corney, I think the information that you have provided here tonight has been very beneficial for our audience. We want to remind everyone that Women First is located at 817 Greenbrier Parkway, Suite B, here in the city of Chesapeake. You can give our office a call at 757-548-2800 to schedule your in-office consultation. We're looking forward to seeing you all. We're looking forward to doing more webinars and bringing more education and inspiration to each and every one of you each week here on our YouTube channel. You can continue to ask us questions on YouTube, or again, as I said, you can give our office a call, or you can visit us, 817 Greenbrier Parkway, Chesapeake, Virginia, Suite B.
And Belinda, I heard you say Chesapeake, but I didn't hear you say Virginia.
Virginia.
Chesapeake, Virginia.
Virginia.
And is it possible for a viewer to go to YouTube and be able to see that video on from Luminous about the FemTouch?
It is, Dr. Corney, and as a matter of fact, it looks like the video is now available.
Okay, so maybe we can take a quick
you can take a look at it and see a simulation of how the Luminous works inside, the FemTouch works inside of the vagina.
And while you guys are viewing it, you're seeing the laser being rotated around the vagina, and if you can look, you see the vaginal walls are actually changing as the light is being delivered to the vagina and is being withdrawn. Each one of those times that the pulse is being directed to the vagina, a patient might appreciate vibration. And then this whole process takes approximately 5 to 10 minutes. It's not very long at all. And so it's a good thing. So I just wanted to make sure that you guys had an opportunity to see that. And we are so excited about the FemTouch, and we would definitely, we want to contact and we want to touch as many women as we can, because a lot of us are baby boomers, and we are not going to go down without a fight, okay? So we're there to have fun, and we're here to live a healthier life. So please, contact the office, and we look forward to seeing you soon. Thank you, Belinda.
Thank you, Dr. Corney.
Okay.
Good night.
Good night.
Very good.